you did a good job with Mrs. Smith today. I also like your documentation very much. Shall we see her in 2 weeks' time?
Yes, thank you. I will let her know.
Thank you very much, Leslie.
Hello, Dr. Mosqueda.
Well, hello, Dr. Lee.
Hi, Dr. Mosqueda. Good to see you.
Good to see you too. Glad I ran into you.
How are you doing?
I'm doing just fine, thank you. Looks like you're having a busy day. You know, just as I was coming in, I passed by a physician assistant student.
Yes, that was Leslie. She's an excellent student.
Oh, I've just been learning a little bit more about physician assistants, PAs. I always thought PA just stood for Pennsylvania, but apparently it also stands for physician assistant.
Oh, they're a great addition to the team.
Yeah.
I have both a medical student and a physician assistant student, and sometimes they work together, but independently. Physician assistant students are trained in a medical model, and so they work very well.
What all do physician assistants do?
They have the same scope of practice, very similar to the medical model. So it's like working with a physician colleague. They take care of patients from throughout the lifespan. And they can also work in whatever specialty they choose to, from primary care to subspecialties to surgery. It depends on the physician who supervises them. And also, there are some state laws that govern the scope of practice, but in general, they are very much a part of the medical team.
Well, you know, now that I've learned more about physician assistants and that PA doesn't just stand for Pennsylvania, it seems to me like it would be a great addition to have PAs as part of my practice.
Yes, let me tell you about Dr. Robinson, a colleague of mine. She's a family physician who precepts PA students, and she has a great way of orienting the student, assessing the student, and giving effective feedback.
In orienting the PA students, it's important to introduce the student to the medical staff. You should sit down with the student to set ground rules and expectations for the clerkship. I usually watch the students with some patients first and repeat an appropriate amount of the history and physical. Once the student is comfortable with the system and I'm comfortable with the student, I allow the student to make the first contact with the patient. The staff can definitely provide insights for the student.
Hi, Mrs. Green. How are you?
No, I've been better, but I'm glad to see you today.
It's nice to see you too. I want to introduce you to Gary. He's a physician assistant student who's working with me today. He's going to talk with you for a few moments, do an exam, and then he'll come out and speak with me. We'll talk about our plan of care and then come in and share that with you. Is that okay with you?
Yeah, I think that'll be fine.
Effective preceptors should be able to create an atmosphere that allows the student appropriate learning opportunities. It's also important for preceptors to develop trusting relationships with their students and provide them with an honest and regular feedback about their progress, as this will help them grow into successful healthcare professionals.
So what were your findings?
I believe the patient has tonsillar enlargement and erythema.
Excellent. Based on your physical exam findings, what do you think is going on with this patient?
I would say the patient has tonsillitis,
And what's your differential diagnosis?
streptococcal tonsillitis, viral tonsillitis.
What would you do next?
I do a rapid strep test.
I like your thinking about doing the rapid strep test. You should also consider in your diagnosis and your differential infectious mononucleosis with this patient's history.
That's right.
So I'd like you to go home tonight and read on those diagnoses, and we can discuss it more tomorrow.
Okay. Thank you.
Get a commitment. Get the learner to commit to one aspect of the case. Probe for supporting evidence. Ask question and determine adequate basis for the answer. Reinforce what was done well. Discuss strengths. Give guidance about errors, omissions. Discuss areas of improvement. Teach a general principle. Brief teaching focused on the encounter.
So let me tell you about my colleague, Dr. Diatola. He's a family physician who works with students from many different professions. He can definitely tell you about the benefits of precepting a PA student.
Physician assistant, medical, and nurse practitioner students are all trained in similar models, bringing different depths of education and experience to their clinical practice. All are expected to perform history and physical examination, a case presentation, documentation, be able to write a prescription, and provide patient education.
I really liked how you spoke with the patient. How did you learn to have such great bedside manner?
Thank you. Before I started PA school, I worked at a community clinic, and all of my classmates in my program worked in a clinic or had patient care experience.
Wow, you've had a lot of previous patient experience.
Thank you. I really liked your detailed differential. Where did you learn that?
I learned that.
The students get to learn what it's like to practice family medicine. They interview and examine patients. They assess the patient's needs and come up with the diagnosis and plan to treat the specific problem at hand. They draw blood, they give injections, and they learn to be part of the healthcare team. PA students will arrive with approximately the same clinical knowledge base as a third-year medical student. They will be able to do a head-to-toe history and physical exam, as well as a focused history and physical exam documentation and case presentation. It's quite enjoyable, as the whole experience keeps me on my toes. I enjoy teaching and medicine, so it's a great fit for me. I'm not just standing in front of a classroom giving a lecture. Instead, I'm having them walk with me from room to room, meeting with the patients and discussing the patient's history and the next steps. The whole time, I'm also learning. I love it.
Students ask questions that can challenge preceptors. This encourages lifelong learning and keeps us engaged in our practice. PA students have generally spent more time in a clinical setting before beginning their clerkships. Since they're quite familiar with how a clinic runs, they are comfortable with the preceptor and their staff right from the start. PA students are ready to begin clinical practice before they walk in through the door. They are well prepared with procedural and clinical skills before they start working with the preceptor. This means I don't have to spend a ton of time teaching them those skills. I found that patients love the attention that PA students can provide. They often feel at ease with the positive experience of having a PA student take time to listen to them.
Well, I get asked this question all the time. And because medical students and PA students overlap so much in their clinical education, it's really easy for me to have them work together. In fact, it's very nice when they can assess a complex patient together and get the information that I need to be able to take care of this patient. Frequently, it's better organized and more complete. My patients also actually love the approach because they get to have a lot of human contact time, which I think is one of the things that patients really enjoy. The students also get to know each other's professional roles much better, and it gives them a terrific perspective on the future and how it is to take care of patients in a team. If there's a space in the clinic, it would also be ideal to have other disciplines present. Occupational therapy, pharmacy perhaps, would be nice to have just to enhance the patient experience, the clinical experience, and the gathering of the information that leads to an effective patient encounter. Interprofessional education enhances learning and patient care both at the same time.
Thanks, Ms. Chung. We appreciate you taking your time and explaining your medical condition and also letting us examine you. We're going to be talking to our preceptor, Dr. Diatola, and then we're also going to be coming back with our plan.
Okay,
Thank you.
Thank you so much.
You're welcome. Thank you.
We'll be back soon. So, how should we split our roles for presenting to Dr. Diatola?
Why don't I present the history and you can present the physical, since that's how we split up our roles with the patient. Or you could do the assessment and plan and I could fill in with whatever is missing, and the next time we can reverse our roles.
Sounds like a great plan to me.
So you saw Ms. Chung.
Yes, we're going to present the patient. Ms. Chung is a 30-year-old female. She's here for follow-up of her newly diagnosed diabetes. She's been compliant with her medications, but she is struggling with her diet, so she wants a referral to a dietitian.
Very well. Hi, Ms. Chung.
Hi.
Great to see you again.
Thank
So these students gave me a very good idea of what's going on with you. I'd like to confirm a few of their findings, and then we will put together a plan that works for everybody.
Okay, thank you. Dr. Diotola, I appreciate your students very much. They are courteous, attentive, and very patient. They spend a lot of time with me, and it's great to have multiple opinions. And I'm pretty clear about what I have to do now. Thank you.
You know, now that I've learned more about a physician assistant scope of practice, it makes a lot of sense to have a PA join us in our primary care practice here. It also seems to me that having a PA student is just as easy as having a medical student with us too, and so we could have them join. The sooner people start to learn about interprofessional care and interprofessional education, I think the better. And our patients love having medical students, so I'm sure having a PA student will be equally enjoyable for them too.
I agree with you, Dr. Mosqueda. Let's talk more about it.
Okay.